So one of the best things that you can do for your mental health straight away is to start tracking things about your mental health, like your mood, as well as things about your physical health, like how much you're eating, how much you're sleeping, how much exercise you're getting. And there are two really important reasons why we think this is really important. So the first reason is knowledge is power. So most people aren't really aware how closely related their mood and their physical health is. But one really great example of this would be your eating. So we all have had that experience when we're feeling really anxious of feeling knots in our stomach or feeling a bit nauseous or kind of losing our appetite. And we know that the relationship goes the other way. So just like we don't want to eat when we're feeling really nervous, when we stop eating, that can actually have a really powerful impact on aspects of our mental health, like our anxiety. And so what lots of clients don't realize when they first start seeing me is that on days when they're feeling really anxious or they're having panic attacks, those are often the days when they've skipped a couple of meals or they haven't been eating enough food. And so once they start tracking what's happening with their eating, what's happening with their mood, that's when we can start to see how powerfully these things are related to each other. And the same is true of sleep. People who don't get enough sleep see a really powerful impact on their mood and on your exercise as well. If you're not getting outside enough, if you're not kind of going for at least half an hour of walk during the day, then people also see a really powerful impact on their mood. And often they're really simple things that we can do together to make changes to your sleep, to your eating, to your exercise that can have a really powerful impact on your mood. So knowledge is power. The other really important reason is so that your therapist can give you better help. So accessing mental health care is often really difficult. It costs a lot of money. There are a lot of wait times. It's really hard to find a psychologist, psychiatrist that you get along with really well. So you want to make sure that you're making the most of the time that you have when you do manage to find someone who you work really well with. So the more information that you can gather about your mood, about your sleep, about other aspects of your physical health, the more information you and your therapist have to use to come up with interventions together. So as therapists, we have lots of different tools in our toolbox, and it's sometimes not always easy to tell which exact tool is going to work for each client. So you can use that information to tell your therapist, hey, this tool isn't working, can we try another one? So those are two really powerful reasons why something as simple as tracking your physical and your mental health can lead to kind of a better life for you.